All right, so we have joints and articulations in our body, and they work as levers. They enable us to move our limbs, right? So long bones act as levers to enhance the speed or power of limb movements. And a lever is any elongated, rigid object that rotates around a fixed point that we call a fulcrum. Rotation occurs when an effort applied overcomes the resistance, or what is sometimes called the load, at some point. There is a resistance arm and effort arm, and they are described relative to the fulcrum. So, a first-class lever. This has a fulcrum in the middle between the effort and the resistance, which is shown here in the pictures, RFE. So an example of this is your atlanto-occipital joint that lies between the muscles on the back of the neck and the weight of the face. And if you've ever fallen asleep in class, which I'm sure you haven't, when you nod and your head moves forward, that is due to a loss of the muscle tone in this area. So that is when the resistance basically overcomes the effort of holding up your head and your head tips forward. Then there are second-class levers, and these are set up a little differently. This is where the resistance is between the fulcrum and the effort. So this is an FRE, which is shown in the picture. And an example of this is the resistance from the muscle tone of the temporalis muscle that lies between the jaw joint and the pull of the digastric muscle on the chin as it opens the mouth quickly. Then we have third-class levers, and this is where the effort is between the resistance and the fulcrum, an REF, and this refers to most joints of our body. The effort applied by the biceps muscle is applied to the forearm between the elbow joint and the weight of the hand and the forearm. There is something called the range of motion, and this is the degrees through which a joint can move. It is an aspect of joint performance, and it is a physical assessment of a patient's joint flexibility. So sometimes if you have a problem, you may have a reduced range of motion. You may have heard this term in relation to maybe a knee joint or a shoulder joint. And this is what it means, basically a lack of flexibility within that joint. And it is determined by the structure of the articular surfaces. For instance, in your elbow, the olecranon of the ulna fits into the olecranon fossa of the humerus. So that determines the amount of movement, the range of motion that you have in your elbow. There is also dealing with the strength and the tautness of ligaments and joint capsules. And this refers to the stretching of ligaments. As they increase, so does the range of motion. Double jointed people have a long or slack ligaments. Some people are much more flexible than others. This could be due to repeated stretching or to actually longer ligaments. And then there is the action of the muscles and the tendons. And your nervous system monitors your joint position and your muscle tone. And muscle tone is the state of tension maintained in a resting muscle. There are axes of rotation. A moving bone has a relatively stationary axis of rotation that passes through the bone in a direction perpendicular to the plane of movement. In a multi-axial joint, like your shoulder joint, there are 3 degrees of freedom of rotation, right? You can move your shoulder joint kind of in a circle all the way around, but you cannot do that with your elbow, hopefully. Your elbow kind of only goes, a certain way. It doesn't go quite as much as your shoulder. And this has to do with the type of joint it is and the range of motion that it possesses. So, a ball and socket joint is something like your shoulder or your hip. And these are smooth bones with a hemispherical head that fit into a cup-like socket. So basically, your humerus, which is the top of your arm, that bone fits into your shoulder, right? You know all about the bones, and makes it a ball and socket. Same with your hip as it goes into your pelvic girdle, right? So you have 2 girdles in your body, and your arm and your legs fit into them. So in your shoulder, here it says, the head of the humerus into the glenoid cavity of the scapula. And in your hip, it's the head of the femur into the acetabulum of the hip bone. So there literally is like a ball going into that socket. And these are multi-axial joints, and these are the only 2 within our body. And they have the largest range of motion. Then we have condyloid. These are oval complex surfaces on one bone that fits onto a complementary shaped depression on the other. So we see these in our wrists between the radial carpal joints, which is the radius of the arm, and the carpal joints of your hand. And we also see it in the bases of our fingers. And when I mean base, I mean where the base of your finger meets the carpal bones. So the metacarpal phalangeal, your fingers are your phalanges, carpal bones are your wrist, your hand. So where those meet, that also is what we call a condyloid. These are biaxial joints, meaning they can move in 2 planes. You can move your finger up and down and side to side. It can go 2 directions normally. Hopefully it doesn't go a third. That's called dislocation. So it is a biaxial. It can go in 2 planes, as can your wrist, and your wrist where it meets, like where your arm bone meets your hand, right? You can move your hand side to side and up and down. Then we have what's called a saddle joint. This is where both bones have an articular surface that is shaped like a saddle, which means it's concave in one direction and convex in another. One of these is in your thumb, at the base of your thumb, and one of them is at where the clavicle meets the sternum in your chest. These are biaxial joints. They are more movable than a condyloid or hinge joint, and this is what gives us this primate opposable thumb. Your thumb is much more flexible and can rotate differently than your fingers. Then we have what are called plane or gliding joints. And here we see a flat articular surface in which bones slide over each other with relatively limited movement. They are usually biaxial. So this could be referring to the carpal bones of the wrist, the tarsal bones of the ankle, and the articular processes of our vertebrae that we find in our spine. Although any one joint moves only slightly, the combined action of the many joints in the wrist, ankle, and vertebral column allows for considerable movement. So because they all move a little, when they all move a little together, it allows for a lot of movement. Then we have hinge joints. This is where one bone with a convex surface fits into a concave depression on another bone. This is our elbow joint, the ulna to the radius, our knee joint, which is the femur to the tibia, and our finger and toe joints. These are monoaxial joints, and they move freely in one plane. And then we have a pivot joint. This is where one bone has a projection that is held in place by a ring-like ligament, and one bone spins on its longitudinal axis. So we see this between the first and second vertebrae in our neck, which is, we see the dens of the axis and atlas. This is why your neck and head can move the way they can. We also see it in the proximal radial ulnar joint, which allows the radius to rotate during pronation and supination, which means when you're putting your arm, if your palm is facing forward and then your palm is facing backwards, that is pronation and supination. And this is a monoaxial joint.